Critical events or crisis situations occur in the operating room, ICU, ER, and other healthcare locations. Our ability to recognize and appropriately manage these situations can have a dramatic impact on patient outcomes. For this reason, crisis checklists have been developed as a cognitive aid to guide clinicians in the management of specific critical events. Kaiser Permanente has established a set of OR crisis checklists based on the OR crisis checklists developed by Ariadne Labs, Brigham and Women's Hospital, and Harvard School of Public Health. These original OR crisis checklists were developed with the goal of improving care during 12 of the most common perioperative crises. Simulated use of OR crisis checklists by operating room teams has demonstrated that these teams can improve adherence to critical steps during crisis management. Furthermore, when crisis checklists were correctly utilized, performance was improved by every team member. Kaiser Permanente OR crisis checklists include 14 crises. Each is 1 page in length and is numbered alphabetically. These checklists begin with the signs and symptoms associated with the crisis. Then they proceed through diagnostic and management strategies, doses for critical medications, and suggestions for other potential complications. The purpose of the following videos is to educate and encourage dialogue among healthcare providers so that we may improve the safety, timeliness, recognition, and management of crises by using these crisis checklists.